Yeah, a quick question. I was trying to understand how this would ultimately work as it would with, say, any other promising compound or drug, all the way through the investigational new drug process and then the new drug application process, the FDA processes. Can you explain to me at what point it would become something that would be regulated by the FDA, and to what extent it would be subject to the clinical trials and the other things, or to what extent it already has been?
Well, you know, I think if you're talking about Marinol, you know, those, but that's already been through the process. If we're talking about using the, you know, and we've learned since that even came out, we've learned an awful lot about this drug, where it acts, and how it's very similar to those normally processed by our body for controlling the things we're talking about. Appetite stimulation, nausea, vomiting, pain. So I think that if we're going to really, and the other thing is, to me, if we regulated it, it would only be ordered by the doctor. And the doctor would decide what patients that they would get it for. And, you know, and then you could even have whether this is on the approved list of things, if the doctor's going to use it for, you know, somebody. But it's going through the process, you know. If we're talking about using almost a marijuana with the 66 plus or more, maybe even more chemicals in them, well, you know, that would not be what the drug company would be wanting to refine and make and produce. And you know, they would want to, like they have Marinol or THC, or they know that's the major component that's mostly related to the psychoactive, you know, the mood altering effect. So that, you know, they'd be pulling, maybe trying to pull each one of them out. But they're going to just study the use of vaporizing it and how it affects the things that we already know about. But then that probably would not be a very difficult study. But you know, young people and nobody else who's using it for recreational purposes is going to do that.
We keep talking about the doctors and what's best for their patients. And if you don't mind, I would like the opportunity to read you the official policy statement for the American Medical Association. The AMA calls for further adequate and well-controlled studies of marijuana and related cannabinoids in patients who have serious conditions for which preclinical, anecdotal, or controlled evidence suggests possible efficacy and the application of such results to the understanding and treatment of disease. The AMA recommends that marijuana be retained in Schedule I of the Controlled Substances Act pending the outcome of such studies.
I don't disagree with the statements of America that the AMA said. I think that was what I was really, in many ways, when they said that I was really trying to say. However, I really have problems with it being a Schedule I substance, because if you're talking about something that's a Schedule I that says it's addictive, has no benefit, that's what a Schedule I does, as I understand it.
I want to thank Dr. Elders for coming and making her presentation, and we all could give her a hand for it. I want to thank the two members of the committee who did come out, and I thought the question was very thought-provoking, and we had us move to making a decision about you asking questions you asked. I really appreciate that. I also want to thank all the people who have come out this afternoon. And let me just say this, is that, you know, in order to move a society or a country forward, you have to deal with those various issues that need to be dealt with. It's not like you can't bury your head in the sand. We do have people out here that are using marijuana illegally, and many of them are sick. Some people are using it for entertainment purposes. What we're talking about is making marijuana possibly available for those citizens who suffer extreme pain. Many of them are elderly citizens, and those citizens have other chronic diseases. There are 12 states, as I indicated, that have passed laws, and in those various states, other than the federal government interfering with so-called local state control, the data is pretty much out there that this committee is established in North Carolina to study this, can look at some of the trials. From my understanding, from my reading, there are states that have the data now that demonstrate and show that marijuana for medical purposes has had extreme benefits for multiple sclerosis, for various cancers. Dr. Evans mentioned when people have cancers, that in diabetes, and there's something called, as she had mentioned, wasting away. You have people who have cancer and other types of disease, they lose weight, and they look frail and extremely thin, and they just simply waste away. Marijuana has clearly been demonstrated to stop that process. People gain weight, they have a higher quality of life, they're psychologically and emotionally enhanced. And these are the things that we need to look at. And America has gone through a time in the last 8 to 10 years, what I call the dark ages. Science is what's going to keep this country moving ahead, and it's going to keep this country in this global economy. We're going to keep this country in the forefront of technology and medical breakthrough. And it's going to be really left up to states like North Carolina and the 12 states that have passed marijuana law to seriously look at these various issues in a serious way for the benefit of the citizens. And I think that as elected officials, whether in the state of North Carolina or whether at the federal level, we owe it to the citizens to look at issues, specifically health issues, in a critical manner, in an objective manner, based on concrete scientific research, and make decisions that's going to benefit the citizens and implement public policy that's going to benefit the well-being of the citizens in North Carolina and in this country. And I think we abdicate our duty if we don't at least study these various issues. And I hope that you will call the leadership in the House. And let me say this, the bill asks for a joint study. That means you have the Senate and the House on a committee that will study this particular. One mistake I think that I made when I was trying to push the embryonic stem cell research bill was that we had a study that was made on the House members, or select members of the House. And those House members, once they became educated, the majority of them, did support the legislation. So that's why this particular study requesting a joint study, which would include the Senate and the House, because it makes it much easier when people get accurate information and many myths are dispelled, the misinformation is exposed. People and policymakers use it to make the right decision. And regardless of what you heard or seen on TV, elected officials or public servants here in the state of North Carolina and throughout this country, they're the best of the best. They're elected by people who have trust and faith in them. And I'm sure that with a study, that our legislators here in the state of North Carolina will do the right thing and make the right decision. But I would encourage each one of you to call Speaker Hackney, our Majority Leader Holloman, Bass Knight, Perdue, all of the people who are, I call the leadership of the General Assembly, to ask them to at least allow a joint study of the General Assembly regarding this most critical and important issue that will have an impact in a positive way on the quality of life of our citizens. I want to thank all of you for coming out, and thank you very much for coming out.
Don't want anything.
That's right.
Yeah,
No, that's a real issue.
so thank you so much. I have lost my
Studies they've done have proved, they wanted to prove the detriment of marijuana.
That's right.
Just prove the
That's
positive
right.
effects,
That's
and
right.
they shut down the study.